This video is about CAR T-cell therapy, and the title of it is Revving Up the Immune Response to Cancer with CAR T-cells. Blood cancer affects millions of people worldwide, and it affects the function and production of blood cells. The out-of-control growth of blood cancer cells crowds out the normal cells in the blood and prevents these normal cells from developing and performing key functions. There are three main types of blood cancers, and these include leukemia, lymphoma, and multiple myeloma. An estimated 1.24 million blood cancer cases occur annually worldwide, and this accounts for about 6% of all cancer cases. Every 3 minutes, one person in the US is diagnosed with blood cancer. So what are the symptoms of blood cancer? Some of the common symptoms are loss of appetite and persistent fatigue. However, there are many more depending on the kind of blood cancer you have. Luckily, there are a variety of treatment options available, and these include chemotherapy, radiation, stem cell transplantation, and CAR T-cell therapy. And I will be expanding a bit more today on CAR T-cell therapy. In the body, we have a variety of immune cells that protect us from getting cancer. One of these important cell types is the T-cell. T-cells act as the hero of the immune system because they search for and seek out sly cancer cells. Because of this hero role of the T-cell, let's give him a Batman outfit. And as we all know, Batman goes nowhere without his Batmobile. So correspondingly, the T-cell goes nowhere without his T-mobile. Off to protect the body from cancer cells. The T-cell will patrol through many different tissues of the body and will keep an eye out for cancer cells. When the T-cell comes across a cancer cell, it will capture the cancer cell and remove it from the body. However, cars have blind spots, and so does the Batmobile, aka areas that are difficult to see while driving a car. Sometimes, cancer cells will hide in these blind spots and go undetected by T-cells. As a result, these cancer cells escape capture by the T-cell and start expanding and spreading throughout the body. This is where CAR T-cell therapy comes in. With CAR T-cell therapy, a few of the patient's T-cells are removed from their body. In order to promote the T-cell's mission of finding and killing cancer cells, fancy security cameras are added to the sides of the T-mobile. These cameras allow the T-cell to detect cancer cells even if they are in the car's blind spot. These CAR T-cells are then expanded to a large number before being injected back into the patient. Before CAR T-cell therapy, the T-cell was not able to detect cancer cells in its blind spot. However, these new CAR T-cells that were injected back into the patient are able to see all around them and can detect the sly cancer cells. The CAR T-cell is now able to capture the cancer cells and remove them from the body. Amazingly, the first approved CAR T-cell therapy had an 82% remission rate, meaning that the treatment worked for 82% of patients. And currently there are 6 FDA-approved CAR T-cell therapies, 2 that treat multiple myeloma, and 4 that treat lymphoma. CAR T-cells saved the day.